Hi, my name is Dr. Michael Cooney, and I'm a board-certified ophthalmologist in New York City. It's a pleasure to be here today with Health Power for Minorities, and I greatly appreciate the opportunity to speak with you further about a big public health problem called age-related macular degeneration. You've submitted a list of questions, and I'm happy to answer them, so let's get started. The first question you asked was, what is wet age-related macular degeneration, or wet AMD? Well, macular degeneration, or AMD, is the leading cause of vision loss in people over the age of 50 in the United States. Unfortunately, it's a growing public health problem as our society ages and the baby boomer population ages. And it's a big problem that needs a big solution. To fully understand macular degeneration, you need to understand that the macula is the part of your retina that's responsible for your fine, straight-ahead vision. So reading, seeing faces, watching TV, what most people would consider their finest vision. The most common type of macular degeneration is what's called the dry form. And in the dry form of macular degeneration, what happens is little aging changes begin to accumulate in the macula that oftentimes have no vision symptoms to a patient whatsoever. But those little aging changes can weaken the retina and weaken the macula and set the stage for a more advanced form of macular degeneration, which we call the wet form of AMD. And about 1 out of every 10 people will convert from the dry form to the wet form. What happens in wet AMD is a little blood vessel starts to grow into the macula into very sensitive areas. And those blood vessels can break open and bleed, leak fluid, and cause scarring, all of which can cause a very abrupt and rapid loss of your straight-ahead vision over weeks to months if it's not detected early and treated early. The good news is we have good and effective treatments for wet macular degeneration should you develop that. Your next question was, what are some of the risk factors for macular degeneration, and what are some of the symptoms? I'd like to break down the risk factors for macular degeneration into 2 types. First, risk factors for which you have no control over or can't do anything about, and secondly, those risk factors that you actually can have some control over. Addressing the risk factors that you have no control over, first of all, the biggest risk factor is age. With every advancing decade over the age of 50, your chance of developing macular degeneration rises exponentially. Secondly, is your family history or your genetics play a big role in whether you have a risk of developing AMD, about an 80% risk related to your genetics. Females have a higher risk of macular degeneration, as do Caucasians. You can't do anything about the things I just mentioned. The other risk factors, or modifiable risk factors, are things you can actually do something about. Probably the most important one is don't smoke. Smoking increases your risk of developing macular degeneration 4 times. So another reason to quit smoking, and certainly a reason to not pick up the habit. Blood pressure control, exercise, weight loss, good nutrition and wellness all go a long way towards helping to reduce your risk of developing macular degeneration and macular degeneration progressing. I like to think about that group of risk factors as the same types of things you would do to take care of your heart are the same things that are healthy to take care of your macula. What are some of the symptoms? Well, the vast majority of patients with macular degeneration have the dry form, and oftentimes most of those patients have no vision symptoms whatsoever, which increases one of the take-home messages here, which is that every person over the age of 50 needs to have a full dilated eye examination to be screened for macular degeneration, because they may not even know they have it because they have no symptoms most of the time. If you develop wet macular degeneration, common symptoms there may include where things that are normally straight suddenly become curvy or distorted, or you may develop a new blank spot in the center part of your vision that does not go away after about 24 hours. Should someone with macular degeneration develop those symptoms, they need to get in to see their ophthalmologist for a full dilated assessment, because there's a high risk they've developed wet macular degeneration, and like anything, early treatment and early detection, early treatment go a long way towards a better outcome. Your last question was, what can people do to preserve their eye health now and in the long term? Well, the good news is there are treatments for macular degeneration, both the dry form and the wet form. What it did not say is that there is a cure. For people with dry macular degeneration, we know that vitamins play a role through National Eye Institute clinical trials. Now, vitamins are not for everybody, and you need to check with your eye doctor to see if you should be put on vitamins should you be diagnosed with dry macular degeneration. If you have wet macular degeneration, the good news is we have effective therapies to stabilize that condition. There are a number of medicines that have been approved by the FDA that are proven to stabilize that condition and in many cases reverse the vision loss and improve vision. For example, there's a medicine called Lucentis, which was approved by the FDA about 10 years ago, which was the first medicine to show that wet AMD vision loss can be reversed in about 35 to 40% of patients. Like all medicines, medicines come with side effects, and you should check with your doctor to see if these medicines are right for you. And lastly, your last question is, where can people go for additional information? There's a great website, www.preventblindness.org, which has a wealth of additional information on this topic, as well as other age-related eye disease topics. It's been my pleasure to speak with you today about age-related macular degeneration, and I want to thank Health Power for Minorities for having me here today. Thank you.